They say that preventative medicine is the best medicine, but how do you get it? I'm Dan Ringer, and we'll talk about community health centers right now on The Law Works.
From West Virginia Public Broadcasting.
The Law Works is made possible by the generous support of the West Virginia State Bar, the Monongalia County Bar Association, and by a major grant from the West Virginia Bar Foundation, promoting public knowledge of the law in West Virginia. The West Virginia Bar Foundation, the philanthropic organization for West Virginia's legal profession and justice system.
If you work at or near minimum wage, at a job with no benefits and certainly no medical insurance, what do you do about health care? My guests are Nancy Vandergriff and Linda Shriver, both lead community health centers here in West Virginia. There are people at home right now, ladies, scratching their heads saying, what's a community health center and what does that mean to me? So, Linda, what's a community health center?
Community Health Center is a primary care office providing medical care from birth through the end of life. I provide preventive care, diagnosis, treatment, and following you through the different stages of your life.
You read that somewhere, didn't you?
No, I didn't. No, I didn't.
But that's a good answer. What's primary care?
Primary care is health care services, which is prevention, following the patients in the hospital, nursing homes, as well as home visits, providing care to the patient.
It's where you go when somebody says you need to go see your doctor.
Yes.
You know, if you've got the flu or your foot hurts or something like that. Now, you are the CEO of Preston Taylor Community Health Center.
That's correct.
In the northern part of the state. Nancy, you are the president of the Monongahela Valley Association of Health Centers. Say that 3 times real fast. And that's located in Marion County.
Correct.
And you each have other offices other than just your main office.
Yes, we have 7 locations. We have 1 dental center and medical center in Taylor County. We have 3 sites in Preston County, in Eglin, Newburgh, and Rollsburg. We have a Davis Health Center in Davis, West Virginia.
In Tucker County.
In Tucker County, and in Grant County we have the Mount Storm Health Center.
And Nancy, you have 2 facilities?
Yes, we have 2 primary care facilities and 2 school-based health centers, which we have the Fairmont Clinic located in Fairmont, Shinston Medical Center located in Shinston, West Virginia. Then we have wellness centers in East Fairmont High School and North Marion High School, and they provide care to the students.
What kind of, when somebody in a school says you need to go see the school nurse, that's the kind of thing
yes.
that you do there?
Yeah, it's basic primary care, which is your doctor visit, any evaluation that you might need, sports physicals. We offer a lot of services at the school, some mental health services, a wide range of services that we offer.
This program came about because I met a young fellow some time back, and I inquired of him. I said, "How are you?" And he said, "I'm okay, except that I've got a problem with my ear. I think I have an ear infection." And I asked him, as we tend to when we meet people who aren't feeling well, I asked him what the doctor said about it. And he said, "I can't afford a doctor." He was a college graduate, working at just about minimum wage. He did not have health insurance through his employment. He needed to see a doctor. He couldn't afford it. And I suggested in that case that he go to a community health center. He did. They took him in, evaluated his finances. He was a single fellow. And he ended up getting treatment, getting his medication, getting a return appointment, and leaving within the space of an hour or so, and it cost him $20. Does that get your attention? So many people in our state cannot, they think, afford to see a doctor. And in medical terms, you guys are sort of the cure for that, aren't you?
Yes.
We try to be.
Yes.
Where do community health centers come from?
Community health centers, the first federally funded centers, were opened in the 1960s as a result of President Lyndon Johnson's war on poverty. In 1964, they had the Economic Opportunity Act was passed, and they funded 2 demonstration projects, one in Boston, one in Mississippi, which was the urban and a rural demonstration of providing care to low-income people that didn't have immediate access to health care. Beyond that, from 1964 to 1970, there were 100 centers open and funded as a result of that project.
These things kind of sprang up then
yes,
like wildfire.
They did. Mm-hmm. They said the first 100 by the 1970 were seeing 1.2 million patients.
Who are these patients?
It's everyone. It's low-income patients, also people that do have insurance. The centers are available for anyone regardless of their ability to pay. If they qualify as low income, they are offered a reduced fee charge based on their family size and income. It's similar to the school lunch program.
We treat the uninsured and the underinsured, plus we see all types of patients that have insurance, any types of insurance coverage where we see across the board, but we specialize and have funding to help those who don't have insurance or are underinsured and have high deductibles. They can qualify for this financial sliding fee scale.
So community health centers, if I understand correctly, were organized originally to serve the uninsured, low-income, poverty populations.
I believe so. Community leaders and civil rights leaders back in the 60s identified the need for people not being able to have access to care. And access includes not having health care available in your community or within driving distance.
So if you have an area in which there are no doctors or not enough doctors or no medical facilities or not enough medical facilities, a community health center can be organized.
Yes.
Correct. In West Virginia, that would seem to include most of the state.
Yeah, it does.
Yes, it does.
Yes, it does.
In fact, Nancy was kind enough to provide us with some maps that we're going to put here on the screen in just a second. It's a map of West Virginia showing the medically underserved areas as of January of 2010 in West Virginia. And Nancy, that's darn near the whole state.
Yes, it is.
There are some areas that appear to be, that are not designated here. Cabell County, where Cabell Huntington Hospital is, Kanawha County, where WVU Charleston is, the Greenbrier, where the Greenbrier County, where School of Osteopathic Medicine is, the eastern end of Monongalia County, where West Virginia University is, and part of Marion County, where you are,
correct,
and Fairmont General is. But pretty much the rest of the state is identified as being a medically underserved area.
Correct. And some of those counties also is based on the population. They have a small population, so they don't have enough providers to cover, you know, the provider to population ratio allows them to be medically underserved. And
so, well, as with any other form of business, there's not a gas station on every rural street corner. There's not a supermarket in every small, sparsely populated county, and there's not a doctor's office or a hospital either, because you just can't afford to have them there. And community health centers are at least a part of the answer to that. So, if I come in, I have no insurance, I have no money. You said it's paid for by funds that you receive from whom?
well, that's the Health Resources and Services Administration. HRSA is what they go by. It's federally funded program. It's called the Section 330 funding through the community health centers, which is how we get our name.
So the federal government pays my medical bills if I can't pay them myself?
Correct.
Not directly.
No, yeah.
We receive a grant to help us pay operational expenses to keep the facility operating.
So you don't bill the government when I come in?
No.
You have a grant, and that grant's applied to provide care for people who can't afford it?
Yes, correct. Mm-hmm.
But you don't restrict access to just people who can't afford it. You'll take anybody, including people who have insurance.
Yeah, we're multi-service facilities. We offer, any one of us can offer from primary care to lab, x-ray, pharmacy, dental, mental health services. I mean, through the state, they offer a lot of different services depending upon which community health center.
There are people at home now upset because what you're doing is taking federal money to pay for medical care for people who won't go out and get jobs to pay for it themselves.
That's not true.
No.
What is true then?
We are actually we are providing accessibility by having a health center in the area that is accessible to them, that they can travel there to receive their care without going maybe a half a day away, or 45 minutes to an hour to get to a doctor's appointment. It's within the community, and part of the Community Health Center program requires us to have a community-based board of directors, and those members contribute to the board in determining what services we need to provide and what is needed in the area. And the idea of the Community Health Center and the community board was that each center would be developed to be of the people, by the people, and for the people in that area.
I've heard that before, so
yes.
It sounds familiar.
Yes.
But still, this is health care being provided by the federal government, kind of, I guess, like Medicare or Medicaid, but neither Medicare or Medicaid, although I suppose you accept those for payment.
Yes.
Mm-hmm. Yes, we do.
But why would the federal government pay for medical care for the young guy I described who has a job, who's not making a whole lot of money, but couldn't he say if he got his priorities straight, he would save up money to see a doctor and get his health care instead of me having to pay for it?
Well, I mean, he is working. He is trying to make a wage, and he cannot make enough, or his employer doesn't provide health care to him. So this provides an avenue for that particular person, or any other person for that matter, to get care to prevent a more serious problem, to prevent him from going to the ER, which costs a lot of money too. And, you know, it's a service that is needed, and it provides access to services that he wouldn't have, or neither would anybody else without insurance have at that particular point in time.
One of the most successful federally sponsored programs ever, maybe the most successfully federally sponsored program ever, according to most everybody, is the GI Bill. At the end of World War II, returning veterans had pretty much their education paid for by Uncle Sam, by you and by me, or at least our parents and grandparents. The reason it was a successful program is because the GI Bill educated the returning veterans to go out and successfully engage in employment that they couldn't have had otherwise. They were now college educated, or in some cases trained in technical skills that allowed them to earn a good wage and become very successful taxpayers. I went to law school on the GI Bill, and every year I write a check or a series of checks to the federal government for many times more than the amount they invested in my education. I wish I could invest in things that had a return like that. And in very real terms, what you folks do in providing health care does that, or at least is intended to do that.
Intended, yes.
Yes.
You can't have a job unless you know how to do what you're supposed to do and are healthy enough to do it.
Correct.
So you've said a couple of times primary care, dental care, things like that. These facilities each offer what they offer. They don't all offer everything, do they?
No.
Correct. Mm-hmm. Some offer basic primary care. Others, Linda's facility offers dental, which is where we don't offer dental at the Fairmont Clinic, so we refer our patients to Linda's clinic in Grafton or any surrounding area that will accept the folks, because we're the worst in dental care, oral health in the country. The state of West Virginia has the worst oral health care. So this is another way to try to address this.
This is another one of those lists that we're at the bottom of, or
yes,
toward the bottom
exactly.
of. And we fall on those lists concerning obesity somewhere down there too.
So we're out there trying to deal with that problem. I mean, dental services are expensive. So.
We have another map. You may say, I've never heard of community health centers. Where are these things located? This is a map that shows in green the locations of the community health centers in West Virginia. And they're everywhere or within striking distance of everywhere. The few counties, Brooke, Ohio, Tyler, Lewis, Mason, Summers, Mineral, and Hampshire, there is no community health center directly in those counties.
Right, but they may have on the county line, they may have a health center very close to that county. I know Lewis County has one in Rock Cave, and that's close to the Lewis County area, and they cover some of that area. But there are some counties that are not covered at all. And we did receive some stimulus money to try to improve access to health care in those counties that are not served, or even across the state lines where there are areas of unmet need, people that can't
So you don't have to live in the county where the community health center is located?
No, you do not.
So
you have to live in the service area that county covers. Each community health center covers an area. If you live far away, we would refer you to that community health center that's closest to your home. But we mostly cover within a range of our area.
Well, I think beyond that, you do offer patient choice.
Yes.
So if someone would be living in Marion County and would like the physician at one of the clinics in Taylor County, they have the choice to go anywhere they want. And we have out of state because we're near the Pennsylvania, and in Preston and Tucker County, we're near the Maryland border. So we actually have out of state patients in our centers as well.
So we don't view state lines like the Berlin Wall or the Great Wall of China?
No, for statistical purposes with grants, you identify your service area, and then your plans are based on that population to physician or population to dentist ratio.
They call it your target population.
But the patients can go anywhere they like within the whole state.
Right.
Or out of state.
Or if you're visiting someone and you're sick, you can go to that community health center. Say you're a community health center in the southern part of the state, community health center patient, you can come to the community health center at Preston Taylor or Fairmont Clinic or Shinston Clinic.
You at home may be asking yourself, how do I find one of these community health centers? Well, the government is there to help you. That sounds like a warning, but the government really is there to help you. If you have internet access, go to the U.S. Department of Health and Human Services webpage. It's at findahealthcenter.hrsa.gov. Findahealthcenter.hrsa.gov. Now that link will also be on the LawWorks webpage at thelawworks.org with the information about this program. But you can find it, and you can find it by using an internet search engine and typing in Community Health Center, and you will get that link very early on. All you have to do is type in your address or just the name of the town and state that you live in, and you will get an expansive list of community health centers that are available to you. How sick do I have to be before you'll see me?
You don't have to be sick. You can come in for preventive services. If you want to come in, the children going to school can come in for their kindergarten or preschool physicals.
Their immunizations.
You want to come in for your annual Pap test, for breast and cervical cancer treatment once a year, and we'll see you for prevention. Hopefully you won't get sick. Hopefully we can keep you healthy.
One of our focuses is to treat and recognize disparities, health disparities, which could be diabetes, hypertension, and you want to catch those early before you actually develop those diseases. And the only way to do that is to establish a regular visit with your provider and to get your sugar checked and get your preventative health care done to identify if you have a potential to potentially be diabetic, whether you need to have a diet or exercise program. Preventative is probably one of our biggest areas that we like to focus on, because then you don't get so sick. And
so when I walk in and the nice lady behind the counter says, "Hi, how are you?" and I say, "I don't know, that's why I'm here." I mean, you literally can give me my physical, you can check to see if I'm at risk for anything.
Yes.
Yes.
And if I have insurance, do I have to pay my copay?
Yes. At the time of service, you pay your copay. If you're insurance, you pay a copay. If you're a community health center patient also, it's based on a sliding fee scale. Copays can vary from center to center, but they're typically anywhere from $10 to $20 per visit for your basic care, but then the remainder of your care is taken care of by the program or the way that we've established our programs. And
well, how sick do I have to be before you can't see me?
That would be determined by the physician.
Yes.
if you if your problems were beyond what he feels comfortable treating, we have a referral system where we would refer you to a specialist. In this area, it probably would be through West Virginia University.
In the northern
Hospital.
part of the state?
Yes, in this part of the state.
You said West Virginia University and who?
United Hospital Center, the specialists there. Each of our sites have a list of specialists that we can refer to.
So you refer to specialists or to hospitals, or
Correct.
I guess in some cases to emergency rooms.
Right.
You don't have emergency rooms at your sites, do you?
No.
No.
But we do have physicians who follow our patients in the hospital. But those are more for more routine types of illnesses.
One of the big complaints historically in West Virginia has been we have trouble attracting doctors here. You have that problem?
Well, back in the 1960s, when they started the Community Health Center program, they also started the National Health Service Corps. And this allows professionals to attend, to get scholarships to go to medical, dental school, and in return, they'll come back after graduation and serve a period of time in the health center. So we have been able to recruit people that way. More recently, the National Health Service Corps has a loan repayment program. And in that instance, a physician who is looking for a private physician who's looking for a job can come to work for us, and we can pay back, the National Health Service Corps pays back their school loans in return for time spent in the medically underserved area.
So
those are incentives.
Like the old program Northern Exposure, where the doctor goes to Alaska to get his bills paid for.
Yes.
Getting a medical education is hugely expensive. And so some of those loans can be repaid that way.
I believe now it's $35,000 per year of service.
That gets paid for
on
the
their loans,
physician.
towards their loans, yes. And they have to sign a minimum of 2-year commitment, and those can be renewed ongoing either until the loan is paid off, or I believe it's 7 years.
Yes.
I think it can go on for 7 years that they can continue under that program.
I did some reading to prepare for this show, and I found that one of the earliest of the public welfare health centers in the United States, at least, was in New York, and it was a milk program where the government dispensed milk for babies to try to, I guess, decrease infant mortality. Healthier babies make healthier children and adults. That was just the bare bones start. Now, let's say my wife's pregnant. Can she come to you for prenatal services?
We don't offer prenatal services. We refer out for that. I'm not sure whether Preston Taylor does that.
We don't now. We did have an arrangement with West Virginia University, but that program ended, so we are referring our patients to private OBGYNs.
But we take care of the baby once it's born. Most of us have pediatricians or family practitioners, or someone on staff who can treat from the cradle to the grave. That's our.
Well, we can do prenatal and postpartum,
right,
with the delivery being done outside of our center.
Okay. Do you do prenatal and postpartum?
No, we do
also?
not.
Okay, you do. So it depends on the facility as to what's being offered. If somebody has questions about that, where would they go for information?
They would contact the center, each center, Preston Taylor, or
I think they find a health center and then contact this center and ask the questions. We usually have, now we do not, we're developing a website, we don't have one available yet. Some of the centers do have websites that you could go online and look that up.
But not everybody has access to the internet.
No, and it's just a basic phone call to say, this is what I need. Can you provide that? And all of our staff is well informed of what we provide. If not, we try to direct the patient on where they can go to get those services.
Do not be misled at home. Not every community health center has community health center in the name. Now, the Preston Taylor Community Health Center does, so that you'd be fairly easy to find in a phone book.
Well,
that way.
That is the corporation name. Each of our health centers has a different name. Our centers in Preston County are called the Newburgh, Rollsburg, and Eglin Clinics. In Davis, it's the Mountaintop Health Center. We have the Mount Storm Health Center in Grant County, and the Medical Center and Dental Center of Taylor County in Taylor County.
So a phone call to a couple, you might look for the word clinic.
Yeah, general clinic.
MVA's facility has
we're
the
MVA
Fairmont Clinic and the Shinston
Medical Clinic. Yeah.
In most health care facilities, if you were to call them and say, I'm looking for a community health center, I suspect they'd be able to help you. The easiest way is to go to findahealthcenter.hrsa.gov or to the LawWorks website. You'll find that link, and you can find a health care center. In fact, you'll find a whole lot of health care centers that are available to you.
There are 1,200 nationwide, 1,200 community health centers nationwide.
8,000 sites.
8,000 sites. And you didn't even know they existed. Linda Shriver, Nancy Vandegrift, thank you, ladies, for being with us.
Thank you.
Thank you.
Thank you also for being with us. On behalf of the LawWorks, I'm Dan Ringer. Good evening. On the LawWorks webpage at thelawworks.org, you'll find a listing of recent The LawWorks show topics and additional information about this show's topic. If you would like to recommend this program to a friend, you'll find video of this program at thelawworks.org, and you can find previous programs on YouTube. If you would like to suggest a topic for a future The LawWorks show, or if you're a school teacher and would like to receive a copy of this program for classroom use, please send us an email to thelawworks@comcast.net.
The LawWorks is produced in cooperation with the West Virginia State Bar, the Mountain State Bar, and the West Virginia University College of Law. The LawWorks is made possible by the generous support of the West Virginia State Bar, the Monongalia County Bar Association, and by a major grant from the West Virginia Bar Foundation, promoting public knowledge of the law in West Virginia. The West Virginia Bar Foundation, the philanthropic organization for West Virginia's legal profession and justice system.
From West Virginia Public Broadcasting.